Today we are going to talk about cell membrane or plasma membrane. The structure is given by Singer and Nicholson, and the model is called as fluid mosaic model. Okay, in this case it is called as a lipid bilayer. See, I am not good at drawing, so I will just draw a minimum. Here we have hydrophobic head and hydrophilic tail. And then this is called as the transmembrane protein. The transmembrane protein goes through the entire lipid bilayer, and we have some peripheral protein over here which is situated in the periphery. And then when I think about plasma membrane, I think of it like a castle. Okay, in castle fences, the fence, what will the fence do? It will help in the protection and gives the shape, and then it helps in transport. As far as transport is concerned, we have active transport and passive transport. In active transport, if ATP is used, it is active transport. If ATP is not used, it is passive transport. And then it is active transport is going against the gradient. In this one, passive, it is along with the gradient. In case of and then I want to introduce you to some words like endocytosis and exocytosis. Endo means in, cytis means the substances are moving in to the cell. Exo means out, so substances are moving out of the cell. In endocytosis, there are like two kinds of things: phagocytosis and pinocytosis. In phagocytosis, it gives a reaction called as phagolysosome reaction. Okay, this one, what happens? It is like eating. Most people say it is an eating kind of eating. What we are doing is we are eating the big bacteria, and it is done by the macrophage. And then in pinocytosis, it is drinking. It is referred to as drinking the small cells. And then there is something called as receptor mediated endocytosis. It has a receptor and it is highly specific. And then plasma membrane can also recognize cells due with the help of glycolipid and glycoprotein. Glycolipid is just nothing but carbs plus lipids. Glycoprotein is carbs plus protein. Using this, we can recognize the ABO blood group. Based on the receptors present, receptors, antigen, antibody, we can recognize the APO blood group. The most important point is semi-permeability. If we think of plasma membrane as a fence, lipid soluble substance, you need to think of it like birds. No matter how strong your fence is, how large the fence is, the birds can just fly over it. It can easily cross over it. But water soluble is like humans. You need to go through the proper channels. It can't easily go in. And then Semi permeability means it will allow some things in and some things it doesn't allow. In plasma membrane, the most important thing is the composition. It is mostly made up of proteins, 55%, and lipids are helpful for the fluidity, and the carbs is like too less. In lipids, there are like three kinds of lipids: phospholipid, glycolipid, and then cholesterol. Cholesterol is most critical and it has a phosphate group in it, and here we have a carb group in it. Carb plus lipid, phosphate plus lipid, and the cholesterol. Now we are going to talk about some substances like phosphodidyl serine and phosphodidyl choline. This one is help for apoptosis. Usually, if this is the plasma membrane, it will mostly, phosphodidyl serine will mostly be here. When the time to do apoptosis come, it will come out, and annexin 5 will recognize this, and the apoptosis will start. Apoptosis means programmed cell death. So the unwanted cells are killed due to this method. And phosphodidyl choline is also called as lecithin. This is used as a lung surfactant for proper respiration. And then sphingomyelin, myelin, so it is in nervous system. And then we have something called as phosphodidyl inositol. It is a secondary messenger. It will go and message the primary messenger, and that messenger will do the function. In this case, it will deal with the calcium. And then cardiolipin. Cardiolipin is present in the heart. In case of syphilis, we will be looking for the anti-cardiolipin antibodies in serum through VDRL test. VDRL test is like one of the preliminary one of the tests which we use to diagnose syphilis. And then another correlation is LS ratio. LS ratio is also called as lecithin and sphingomyelin ratio. It needs to be more than 2 or equal to 2. If it is like that, the baby's lung is matured, lung maturity. If it is less than 2, we have a problem. The baby's lung is not matured, so the management will be done in pediatrics. And cholesterol, it is present in the skin cells. We will do the same in biochemistry too, and we might cover in ortho. What will happen is, there is a substance called as 7-dehydrocholesterol. When sunlight touches the 7-dehydrocholesterol, it will change into vitamin D. As far as lipids go, the more the fluidity, it is a lot more good. We will do lipids and this cholesterol in biochemistry. And then we have something called as an ion channel, clinical significance. In this ion channels, we can consider chlorine channel. In chlorine channel, there used to be a gene called as CFTR gene. If there is a mutation in this gene, it will give cystic fibrosis. And final, we are talking about proteins. In proteins, before saying about that, I will tell you, this is an normal RBC. The normal RBC is biconcave in shape. Okay, a normal RBC should be biconcave in shape. This is due to two proteins called as spectrin and ankyrin. There are like 4, but these two are like now clinically important. If for some reason, if there is problem in ankyrin, the biconcave will be looking like a spear. The RBC will look like a spear RBC. That is a problem. So it is also called as spherocytosis. Spear shaped RBC. And if spectrin is problem, it will lead to elliptical RBC. So ellipsocytosis. Skeletal muscle has something called as dystrophin. Okay, this is responsible for the muscle strength. So if there is a problem in dystrophin, it will lead to Duchenne muscular dystrophy. What will happen in this case? Muscle weakness will happen and the patient would not be able to stand. He needs to put a support in his knees and his hip, and he needs to stand like that. It is also called as Gower sign. Unable to stand properly. One of the other sign is paralysis of muscle will happen. Paralysis of respiratory muscles will happen. So he can't breathe. Thank you.